Hello, my name's Maury Freitas, and I'm doing my physical examination for Nursing 609 Advanced Assessment. I'm going to go ahead and get started and wash my hands. All right, sir, can you state your name, location, and current date, please?
Sean, I'm at home. It's December 10th, 2017.
Okay, the patient's awake, alert, oriented to person, place, and time. How are you feeling today?
Good.
Mood and affect are appropriate. The patient came in well-dressed and groomed, appropriate for the weather. I'm going to say three words to you, and I want you to repeat them back to me. Boat, fish, lure.
Boat, fish, lure.
The patient's immediate memory is intact. What did you have for breakfast today?
Bacon, eggs, grits.
Okay. The patient's recent memory is intact. And what high school did you attend?
Rummel.
Okay. And the patient's remote memory is intact. Tell me this, what does the early bird gets the worm mean?
Whoever gets to the boat launch first finds the fish first.
Okay, the patient's abstract thinking is intact. If you found $5 on the ground at the grocery store, what would you do with it?
I would give it back to the cashier.
Patient's judgment is intact. What is 20 plus 20 minus 10 equal?
30.
Okay, the patient's calculating ability is intact as well. Next, we're going to go ahead and assess his head, ears, eyes, nose, and throat. First, I'm going to go to the head. Everything appears normal with his hair, scalp, skull, and face. Next, I'm going to assess his eyes. Just start at my shoulder. Pupils are equal, round, reactive to light and accommodation. And if I had an ophthalmoscope, I would assess his his optic disc for red reflex in both eyes, which are intact. I'm also, when I'm looking at his eyes, looking at his iris, lens, and sclera and conjunctiva, which is conjunctiva appeared normal without any redness. Sclera is white without any redness, and iris appears normal as well. His pupils are approximately 3 millimeters in size. Next, I'm going to assess his corneal reflex. Both are intact in bilateral eyes. Next, I'm looking at his nose. His external nose appears symmetrical in size and shape. Also going to look at his nares, which are clear. Turbinates are not edematous. Septum is intact. Next, I'm going to be looking at the patient's ears, which I don't have an otoscope, but I will assess the external features. The auricles are normal. Ear canal is patent without any redness. If I looked inside it, his eardrum would be tympanic membrane would not have a bulge. If it did, that would be indicative of fluid behind his ear. I'm going to go ahead and look at the other side. Auricle is normal, ear canal without redness, and tympanic membrane without a bulge, which shows that he does not have any fluid behind his eardrum. Next, I'm going to go ahead and just talk about the Rhine and Weber test. If I had a tuning fork, I would place it behind the patient's ear and assess how long he hears the sound in comparison to right beside his ear. Air to bone conduction should be 2 to 1 in a normal finding on each side of his ear, on each ear rather. And then the Weber test, the tuning fork will be placed on top of the patient's head, and auditory conduction should be equal on both sides, the left and right. So that's the ears. The mouth, we're going to go ahead and look inside and assess your throat. Open up and say ah. Okay, I'm gonna look at the roof of his mouth, his oral mucosa, and his tongue. Lift up your tongue for me. Okay, frenulum is intact, and posterior pharynx is without erythema or exudate. The tonsils have no edema, and the patient appears to have good oral hygiene as well. Next, I'm going to be looking at the patient's neck. I'm just feeling his lymph nodes, anterior lymph nodes. Anterior lymph nodes, which are not palpable. And go ahead and put your chin to your chest. Posterior lymph nodes are not palpable as well. Okay, look forward. Now I'm checking his trachea to see if it's midline, which it is, and then assessing the thyroid gland, which appears to be normal. Next, we're going to do the cranial nerves. First cranial nerve is number 1, which is the olfactory nerve. For this, I'm going to have you put your finger over your left nostril and take a deep breath in and out. Okay, do that for the other. Okay, now I'm going to have you close your eyes. Close your eyes. Put your finger over your left nostril. Smell this and tell me what you smell.
Pickle juice.
Okay, and switch to the other nostril. And tell me what you smell.
Cinnamon.
Okay, that's correct. So olfactory nerve is intact. Next is the optic nerve. I'm going to use the Rosenbaum chart and have him read the lowest line that he can back to me. Cover your eyes. One eye.
374258.
Okay, switch. Do it again.
374258.
Okay. Sean's visual acuity is 20/30. Next, I am going to. Okay, so so optic nerve is intact. Next, we're going to move to cranial nerves 3, 4, and 6, which is the oculomotor, abducens, and trochlear. My previous assessment assessed that his pupils were, in fact, equal, round, reactive to light. And now I'm going to tell you to follow my finger without moving your head, just using your eyes. Okay, so those are all intact, 3, 4, and 6. Next is the trigeminal nerve, and that's cranial nerve number 5. I'm going to have you clench your jaw for me and move it back and forth. Okay. And then close your eyes and tell me if you feel a dull sensation or a sharp sensation and what side it's on.
Dull left. Sharp right. Sharp left. Sharp top left. Dull top right.
Okay. So trigeminal nerve is intact. Next, we're going to move to the facial nerve, which is cranial nerve number 7. For this, I'm going to have you frown for me. Smile. Raise your eyebrows. Puff out your cheeks. And I want you to try to open your eyes. Okay. So facial nerve is intact. Next, I'm going to move to cranial nerve number 8, which is the acoustic. I'm going to whisper 3 numbers into your ears, and I want you to repeat them back to me.
578. 234.
Okay, so the acoustic nerve is intact. Next, we're going to move to 9 and 10, which is the glossopharyngeal and the vagus nerve. For the glossopharyngeal and vagus, I'm going to have you open up and say ah. Stick out your tongue, say ah. That's your gag reflex. Okay, gag reflex is intact. And go ahead and swallow for me. Okay, so those are all intact. Next is 11, which is a spinal accessory. I'm going to move to the back. Have the patient shrug his shoulders. Okay, trapezius muscles are intact. Cranial nerve number 12 is the hypoglossal. I'm going to have you stick out your tongue, stick it back in, and move it from side to side. Okay, so hypoglossal is intact. Next, I'm going to have you stand up and just kind of walk normally to, right in front of you. And then on the way back, walk heel to toe for me. And then remain standing as you turn around. Okay, so his gait is appropriate, and now we're going to do the Romberg test, which is you close your eyes, put your hands by your side for 30 seconds. But for time constraints, we'll only do it for a few seconds. Sean's posture and balance appear to be appropriate, and you can go ahead and sit down. Next, I'm going to have you run your heel down your shin on each side. Okay, now do the other side. Okay, and now I want you to use your pointer finger and thumb and make a little claw motion. Okay, and also okay, that's good. Now you can put your hands down on your thighs and flip them on upward and downward. Do it again. Okay, so Sean's cerebellum functions appear to be intact. Next, I'm going to close your eyes and tell me if you feel sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay. And keep your eyes closed. Put your hands out. I'm going to test just upward. I'm going to test stereognosis with the patient. I'm going to put an object in your hand. You're going to tell me what you feel.
Feels like a bird feather.
Okay. That's good. And keep your hand out and tell me, I'm going to write a number. You tell me what number I'm writing.
0.
Okay, correct. And proprioception is going to be next. You can open your eyes now. Well, actually, close your eyes. I'm going to take your thumb. You're going to tell me if I'm moving it up or down, okay?
Up. Down. Up. Down.
Okay. All right, all intact. Next, I'm going to test the patient's reflexes using a stethoscope, the edge of the bell. So stick your arm out for me. We're going to do the bicep first. Okay. Just relax. Okay. Next is going to be the tricep. And then we're going to do the patellar reflex next. Okay. Next, I'm going to do the Achilles. I don't know if you can see. Just kind of lift your leg up. I'm going to go right behind. And with the Achilles, you should see kind of a dorsiflex jerk up with the foot. Okay. Next, I'm going to do the Babinski reflex. With the Babinski, stick your foot out again. I'm going to run this object up his foot, and he should point downward and not upward with his toe. If he points upward, that would indicate a positive Babinski, and it would be indicative of CNS disease. Okay, so negative Babinski. Excuse me. Alrighty. Next, I'm going to assess the patient's anterior and posterior thorax and lungs. When I look at the patient breathing, he appears to be unlabored and without use of his accessory muscles. So I'm going to go behind you, and you don't have to. I'm just putting my hands behind his back. Take a deep breath in. Okay. Chest expansion appears to be symmetrical. Go ahead and when I just say 99 for me.
99. 99. 99. 99.
Okay, and now I'm going to percuss the patient's back, right around his lung field. I'm listening for any dull sounds that would indicate just any fluid buildup or any type of pneumonia. Okay, I don't hear anything abnormal. I'm going to go ahead and listen to his breath sounds now. Take a deep breath. Deep breath. And again. And again. And now I want you to say 99.
99. 99. 99. 99.
Okay, perfect. I did not hear any abnormal breath sounds. Patient's lung fields are clear bilaterally in all fields. No adventitious sounds at all. And now I'm going to assess his supraclavicular and infraclavicular lymph nodes. I do not feel, they're not palpable, which is normal. Any axillary lymph nodes, I don't feel any as well either. And on this side. And okay. So, now I'm going to have you lay back and we'll do a cardiovascular assessment. I'll come around the back so everyone can see. Go ahead and lay back. Now, normally when you're doing a cardiovascular assessment, you want the head of the bed to be elevated at 30 degrees, but this is about as good as we're going to get for this. First, I'm going to, before I do the cardiovascular, I want to assess the patient's just breast area for any lumps or anything of that sort. And I don't see anything. I'm going to lift the shirt up for the cardiovascular. And first, with the cardiovascular, I want to assess to see if we have any jugular venous distension, which he does not. I'm going to feel his carotid pulse, which is about a 2+, which is normal. Anything 3 or 4 would be bounding and too strong. So, also with the cardiovascular, I want to find the point of maximal impulse, which will be around about the left mid-clavicular at the 5th intercostal space. So I want to find that if I can, which is about right here on the patient. I don't see on assessment any thrills. I'm going to go ahead and listen. Just breathe as you normally would. Okay, now I'm going to listen to his carotid to see if I hear any bruits, which I do not. Okay. And next I'm going to feel his pulses. I've already done the carotids. I'm going to do the brachial and his radial. Put your hand down and I'm going to do this side. Brachial and radial. All of those are a 2+. And I'll just finish doing my pulses. Hold on, let me catch this before it goes dark. Okay. All right. I'm going to check his femoral pulses. Okay, that's a 2+, and this as well. Popliteal, 2+. Posterior tibial. All right, it's 2+ as well, and the dorsalis pedis, and that's a 2+ as well. All right, so also the precordium, I would also assess on the cardiovascular assessment. Next, you can just keep it right here because I'm going to go to the abdominal assessment. All right, so with the abdominal assessment, I'm going to listen to bowel sounds first in the 4 quadrants: right upper, left upper, left lower, and right lower. All right, no more active bowel sounds. Next, I'm going to check for his liver span using percussion. Okay, so I don't know if you can see it, but it's about right here and right here. Next, I'm going to do the spleen. Okay, so the spleen's about right here in size. The abdominal aorta, I'm just going to check to see if I see any abnormal bruits, bounding movements there, thrills, which I do not. Next, I'm going to do some light palpation in all 4 quadrants of the abdomen. Any discomfort or tenderness? No. Okay. Next, I'm going to, while we're up here, while we're laying down, we'll just check your joints to see if they're all full range of motion. Do this with your hand, wrist, okay? Okay, so the patient has full range of motion in his upper extremities as well. Let's see. Lower extremities we'll do next. I've already done the pulses. So kind of bend your leg up for me. Flex. Okay, you can put down and try the other one. Bend it all the way down like this. Okay, so patient has full range of motion in both extremities. Okay, so you can go ahead and sit up for me. Next, we're just going to talk about some health promotion topics, such as the flu vaccination and the importance of the flu vaccination. Sir, have you gotten your flu vaccination this season?
Yes.
Okay, good, because it's very important. I know you said you had kids, and it's very important for the kids also to get their flu vaccine because we don't want the parents passing it to the kids and the kids back to the parents. So even if the flu vaccination doesn't prove to be extremely effective, it's very important that everybody in the family does get that. Okay, so this does conclude our physical examination for today. Thank you.